Hello, everyone. Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Evalye Alexander, and I am the Career Services Manager for the School of Public Health's new Office of Applied Practice Experience and Career Services. The goal of this series is to explore relevant public health topics with members of our community. And today's topic is careers in public health. Our guest is Dawn Seymore. Dawn earned her MPH with a concentration in epidemiology from Georgia State School of Public Health in 2021. Dawn is currently the K-12 COVID-19 testing consultant with the Georgia Department of Public Health. Now, before we get started, if you have any questions at any point during our conversation, feel free to type it in the Q&A box and we'll try our best to answer. All right, so let's go ahead and get started. Dawn, welcome to the webinar.
Hello, thank you. Thank you so much for having me. I much appreciate it.
Absolutely. And we'll go ahead and jump right into this so that we are making good use of our time. But let's go ahead and provide the audience with a quick introduction of who you are.
Absolutely, absolutely. So I'm a first generation college student. I obtained my undergrad degree in biology from Kennesaw State University. Born and raised in Albany, Georgia. I'm the oldest of my siblings. Prior to my career with Department of Public Health, I spent 8 years with Emory Healthcare working in clinical operations. And outside of that, I'm a foodie and I love to explore Atlanta and everything that comes with that. So.
I love it. I love it. I'm glad that you're here to speak about your take on the careers of public health and where you see the workforce going. And I'm a foodie also, so foodies unite. I'm a foodie also. All right. So tell us a little bit about what inspired you to pursue a career in public health.
Yeah, absolutely, absolutely. So I was inspired to pursue public health after learning I didn't want to be on the treatment end of healthcare. I always knew I wanted to help people. And initially was on a pathway towards medical school or pharmacy school. But after seeing how breast cancer took over my godmother and kidney failure drastically reduced my grandmother's quality of life, it was clear to me that I was more interested in what could be done to prevent these outcomes as opposed to treating them. Public health is not a field where you're going to receive a pat on the back for bringing someone back to life in the operating room or saving them from a house fire. But public health instead is based on forward thought to improve the world around you in effort to eliminate or reduce the need to be in the operating room. Public health is ensuring that certain resources and education is in place to reduce the chance of a house fire. And so I'm the type of person, I'm okay with not having that pat on the back, but my overall satisfaction comes from playing the role, improving the quality of life for society at large. And the ability not to treat one individual at a time, but to improve life for all individuals. And the thing I find most gratifying about public health is that I can help people on a large scale. And be proactive on, treatments and prevent them from having to be in the hospital or sick as much. And so those type of things.
Yeah, absolutely. And can you go into a little bit of detail of how you do that in your current role as the K-12 COVID-19 testing consultant?
Yeah, absolutely. So we are making sure that we can keep schools open and keep schools healthy. And so we're looking, trying to keep kids from having to stay home, keep parents from having to call off of work, because once that kid is sick, someone has to be there with them. And so that means that that parent is going to have to stay home and it's probably missed pay depending on how their job is set up. That also, creates a gap in their job. And so someone else is having to take on the burden of that extra work. Ultimately, that impacts the overall production of the team. And so, we're trying to with providing testing in the school setting, keep the teachers safe and the faculty and the staff, and providing that testing weekly, make you aware of your status sooner rather than later, and you're not as exposed to many people. And so as soon as we identify someone has a positive status, we, put them in an isolated area. We inform the appropriate leadership and the parents. And so we can take, precautionary measures and do next steps testing. And so that way we're able to kind of keep schools open and working on mitigation. We provide HEPA units for air quality improvement, which is not great for just COVID, but also for any airborne illnesses. So we kind of implement those things in the school settings, we've seen a huge increase. As I mean, you probably
Yeah.
have known yourself that from your kids that schools haven't been closed as much as they were initially when COVID was, first on the scene.
Exactly. I know with just having kids in different settings too, private and a public school setting, I can see the difference in how they handle it. But what I think I do appreciate about the public school settings is that they provide that continuous testing. I know with my son, I remember a few weeks before the end of the school year, they were giving every parent, we're required to pick our kids up. They don't bus to school, but they were giving every parent tests. They would give you
Yep.
2
Yep.
free COVID tests.
Yeah.
um,
We did.
and
That was part of my role as well, like making sure that schools had over-the-counter test kits, and I'm still
yeah,
sending them out. We have a warehouse full of them, and we're like, here, we just want you to have test kits on hand or send them home, but prior to, large holidays. So when students are coming back, they can test prior to coming back. We send enough home for the entire family. If that's what you want, that's what you need, because even if that kid, isn't sick, someone else around them may be sick, and that causes the potential for them to be infected as well. So yeah,
yeah.
I'm glad to hear that your school is participating and making sure that you guys receive those test kits.
Yeah, they definitely participated, and it was helpful for me because I've been proactive on this COVID journey and making sure that just my family alone, even if they said you don't have to test at a certain point or just test when you feel sick, we test even if we don't feel sick, just because we are out in the world and people
Yeah.
are no longer really, I guess, utilizing masks as much as
Yeah.
they used to before. And I know with my kids, they're probably one of the only ones in the classroom that still wear their mask. Like I think,
Yeah.
but
Yeah.
everybody else around them doesn't. And that
Yeah.
just, you never know, because they do have to pull it down at some point to eat, to do
Right.
whatever they do. So you never know. And I like to be proactive. So I love that your role helps communities do that and
Yeah.
stay proactive on that front.
Because COVID is still real and
It is.
it's still out there, and test kits, if you have to go into the store to buy one, they're anywhere from 15 to $25. And so, we want to make sure that marginalized communities also have access to them as well. So we're just, whether you are public, private, or charter school, we are supplying test kits with anyone that serves K through 12 population throughout the state of Georgia. So.
That's a beautiful thing. It's definitely needed. So I love that you're in that particular field of work. That's
Yeah.
great.
Yeah, I love it.
All right, so let's dive in. Just as somebody who's been in career services for a good portion of my career, higher education for about 15, but career services being in the last 8 years of my career, I find that this is where I relish the most. And I do believe there is a space to talk about how students or just people in general who are in the public health field or who are interested in being in the public health industry, how can someone who's interested in this career field prepare themselves both academically and professionally? What are some of your advice? What's your advice for something like that?
I would say, I have an area or a few area of interest that you like to
Okay.
pursue. Do some research on those fields and update yourself on current issues in that field. Center your projects once if you're in the programs, to center your school projects around those areas and make effort to network with professors that are maybe already doing work in that field. I saw that to be particularly useful. Take advantage of the professor and student relationship that's at your disposal and to participate in volunteer work, participate in internships and assistantships when those opportunities present themselves. I made some of my greatest connections during grad school. I was fortunate enough to attain a graduate research assistantship under Dr. Heather Bradley. She's no longer with the university, but it was a great partnership and where I gained strong qualitative research skills. I had the opportunity to closely network with other public health students. And don't be afraid to seek out a mentor if if you don't already have one. I think having that mentor to guide you along the way. There's people that have done some of the things you're going to be thinking about doing, have made some of the mistakes that you may make, or already have, some guidance that they can provide to you, and answer questions that you just may not even know that you have. And so, I would say really take advantage of being a student. I think sometimes we get so caught up in the day to day, and we're so busy with schoolwork and just life. But take a moment to take advantage of being a student and having access to your professors. And professors have done years and years of research, and if you find one that, that's doing research on the area that you have of interest, and just spark up a conversation, or just say, hey, I'm here to listen to whatever you have to share. I'm here to receive it. So certainly take advantage of that student to professor relationship.
Oh, definitely. I 1000% agree. That's one of the things that I talk about with students all the time is really to utilize your network, because when you're here in the School of Public Health, you realize how rich the network is. I mean, there are faculty members that are willing to help you get to the next level. They want to provide you with the resources, and just as simple as reaching out to them just to ask questions, or just pull their ear about various topic points. And you'll find too, I always tell students, now that we are gearing up for our next applied practice experience cohort in the summer, I always tell them, hey, start talking to your professors, because they have a lot of projects that they're working on that maybe you haven't considered, and they could actually utilize your help, and you could actually align them with what you need for the curriculum. And so I try to help them kind of connect the two dots. And of course, we have different events along throughout the campus that students can be a part of as well. Internships are big, internships, just to gain that experience before you enter into the workforce. If you're somebody who has never done public health before and you're just trying to get your feet wet, an internship is always the best way. And then of course we have various, like you mentioned, the mentorship opportunities. We have a few mentorship opportunities. One currently that we do have is our alumni mentoring program, and that allows alumni to mentor our MPH students on both the academic and professional side of things, where we're talking about topics like networking and interview strategies and building your resume, making it something public health focused. Those types of things have been very helpful. And from past cohorts before, they've found great benefit in joining a mentorship. I think a lot of the students, the ones that participate, often find that that's another person that they add to their network. And this is another person that they can reach out to when things get a little sticky after graduation, because they don't always look like a linear approach. It looks like a journey. It's very symmetrical. So you got to know where to go, how to move, and sometimes that's not easy. And to have like an ally or a mentor on your side to say, hey, this is really how you should probably be looking at it, or let me talk to a few of my contacts to see who I can get you in to have a conversation with, and a conversation is oftentimes, or could oftentimes, help you win those deals, land those your professional dreams, that you're seeking. So no, I totally agree with you in that. Those are really great ways, and I'm glad that you had the opportunity to be a GRA when you were at Georgia State, because that is
that was huge. That was such a game changer. I wasn't looking for a GRE. I didn't think I had the bandwidth to be able to fulfill such a role. And so just in networking with some of my classmates, there was a classmate, she was a GRA, and she's gone off to do great things. Her name is Jaleesa. And so she actually, we were just students together, and she says, hey, I'm working with a professor and she needs more GRAs. Would you be interested? And I was like, maybe, I don't know. Like, I'm already working a full-time job and being a student, so I didn't think it'd be possible, but it worked out because, it worked around my schedule. And so it was great. And I continued to work on the project over several semesters. And so having that opportunity was amazing. I really got a chance I was new to the field of public health because, like I said, my undergrad was in biology. So being so new to public health, I was concerned, like, where am I going to get experience? It's going to be hard graduating and not having, any experience. And so working on as a GRA, I was able to, really hone in on my research skills, go out into the community, get our, the opportunity to do some qualitative data and work with other teams and work with community advisory members. And so it was great. I mean, it was absolutely a pivotal role in my college career. So I would say to anyone, if you can, take advantage of the opportunity and then volunteer work, don't be afraid to go to a professor and say, hey, I'm willing to volunteer, my time to whatever you have that you need at the moment, because any experience can come back later and be like, something that you can kind of go back and you reach out for. And, it's just really, it's all about networking and building those relationships with people that's going to be, in your career and in your community that you're going to probably down the line, never know when you guys connect with again. So
Yep.
absolutely take advantage of those
Yeah.
opportunities.
Yeah, I even though the industry is broad, it's still a small world. And you're able to really run into somebody that you've had an experience with in the past. I know I've found that throughout my career, so I know that is something that a lot of people run up against sometimes. But okay, so let's talk about just the landscape of public health. How do you think the field of public health will change in the next 5 to 10 years?
I believe that over the next 5 to 10 years, that the field will grow immensely. I think that if the world did not understand or care much about public health before now, COVID-19 sure did open people's eyes and shed light on, how important the role of public health plays on all aspects of life. I was happy to see how many resources were poured into public health with the rise of COVID, and then monkeypox followed shortly behind. And I'm hopeful that society will begin to gain a better understanding and appreciation for the work done by public health practitioners to reduce health disparities and improve health equity overall. Because, I think that, it took something on a large scale like COVID-19 to understand we need public health. Like, public health has been around for a while. But I think people now are starting to see more like, oh, we really need public health and we need to pour into this field of work and grow it, on a large scale. So I'm hopeful that I think I'll have a job for a really long time. I think that public health, and it's not only just infectious diseases, but public health is really in everything around us. It's in the built community, it's in the foods that we eat, the foods that are served at the schools. It's in transportation. It's just really our entire surrounding. Public health plays a role. So
Right.
I'm hopeful that things will continue to trend upward for public health.
I definitely agree with you. I know that just to add my 2 cents in, and you being in the K through 12 space says something, because I do feel as time goes on that the world of public health will be creating more educational opportunities and creating more career paths that begin early on in the field. And I do believe that education will find innovative ways to insert that into the classroom so that we can make our younger students a little bit more aware of that like what you said, public health is all around us, and it isn't just, oh, well, I have a cold, I have a flu, and now COVID-19 will be a part of our new normal. But I think that the future of healthcare, the workforce itself, will definitely become more racially and ethically diverse on a more broader scale, like you said, because we're tapping into closing and achieving those health equity gaps, right?
Yeah.
We're replacing the focus of equity in public health and working in a way that has never been done before. We're we're measuring these health initiatives right now and infusing diversity, equity, and inclusion into the workforce. And I do believe that will bleed over into public health and into marginalized communities and grow and grow and grow over the next 5 to 10 years. So yes, for one, I think you will have a job for years and years to come. For years and years to come. And I think that your work that you're doing now will be very impactful because it was such a historical event globally. And and I definitely think that that will play a huge, huge role in the future.
Yeah,
Um,
absolutely.
yeah, absolutely. So before we get into our last questions, I'm going to check the Q&A to see if we have any questions, and it looks like we do. Someone asked you, is there anything that you would have done differently if you were a graduate student again?
If I was a graduate student again,
Yeah.
I think that I would probably, going into public health, I said, oh, I want to do everything. And that's why this is the perfect field, because I'm not like restricted to just doing one thing,
Right.
which I think, that's one thing about public health. You can certainly do everything, but I think I would kind of map out my plan a little bit better of like, making a little bit more specific, and kind of tying everything together. One thing that I did not realize until a little bit later in my um educational career is looping everything in together, all my assignments, making them become feedback off of each other. And so
Yeah.
I would probably write one paper about this one topic and maybe do another project about something else, when if you're looking to do maybe a dissertation or something at the end of the semester, or any of your large projects that you have to do, if you're building on that semester after semester, then when time comes at the end of the semester for you to do this large project, then you kind of already put all the pieces together, and now
Yeah.
you just really got to fine tune it. So I would say I would probably have maybe one or two really specialized field of interest, instead of saying like, oh, I want to do all 20 of these things. I just want to save the world, before I leave here. Certainly would still like to do that, but I would just kind of specialize it a lot more. And I think that maybe when I started grad school, I was on campus for I want to say maybe 1 or 2 semesters, and then we were virtual, and so not having that opportunity to really connect with your other classmates, that was a little bit challenging. And so I think that we try to do our best with having group chats and things of that nature, but I wish I would have had an opportunity to connect more with my classmates. So I would say to anyone that's now a current student, really really build those relationships with your classmates, because really 5-10 years from now, they're going to be the ones that you're working alongside.
I love that. I love that answer. When I talk to people and I hear that, it's very common for somebody to say the same thing that you said, that they want to do everything, or they don't really have a more specialized focus. And I get it, because it's hard to kind of dwindle down to what you really want to do sometimes without experience. But I always tell people, at least have an idea, like what are some of the things that that you're good at? And now how can we implement those things that you're good at into these aspects of public health? And now how can we tie them together? Here are some of the roles that maybe you can look into, or here are some of the industries, or not industries, but organizations that you could maybe look into that cater to the things that you feel like you're good at. And that helps people kind of get it down or narrow it down just a little more, because it is so broad. And when you get out, once you graduate, you could try for anything, but if you don't have a focus, it will be hard to land and get that thing that you are seeking, or to have something that ties in. Because I do feel like the public health has a fulfillment. There's a fulfillment passion component to it.
Mhm.
And I think it is important sometimes to tie those two together. But yeah, like you said, you've got to have it. And that was a really, really good um, advice about how you would have tied your projects together for your
Yeah.
dissertation.
Yeah.
There's a lot of people that are going to go that route. And so that's a big deal. Okay, we do have a few more questions, Don, before we end. And I'm going to go through them, excuse me, as much as I can.
Okay.
Could you talk more about the research you've been doing as it relates to COVID-19 testing, and what made you want to pursue it? I think the pursue it, because you've already asked about talked about the research, but maybe why you wanted to pursue it to begin with.
Yeah, absolutely. So the project I was working on with Dr. Bradley was called, so there was actually two projects, and one was, called COVID Qual. And so there was this project where test kits were sent out to homes throughout the entire state of Georgia. And a lot of people did not complete the test kits, they did not send them back. So the idea of the sending out the test kits was to get an idea of where the virus was in the community. And so my role as a GRA was to go to these homes, throughout like Atlanta metro area and find out like why people did not complete the test kits. And that was so interesting because we got an opportunity to see, people just felt like, oh, you're trying to send me COVID, you're sending it through the mail, and I didn't know this was coming to me. And they had all these different reasons, but it was great really getting a consensus from society on their thoughts about COVID-19 at the time. And this was at the height of COVID, when COVID was like just really, really hitting us hard. And we were still trying to figure out how to combat it. And so my role was to go out and take this qualitative data, interpret it in quantitative means as well, but figure out what could we do different if we want to involve people in research. Where do we go wrong, and how can we improve this process? So that was interesting. And then we kind of pivot that a little bit more to just interviewing people and asking them their thoughts about COVID, but not just the virus, but also about the vaccine itself. Like what were their thoughts? Because there were a lot of people that did not want to take the vaccine. They had their hesitations, which were, rightfully so. And as a public health practitioner, you have to understand, okay, what are the hesitations that people are facing? What do they need to have done differently in order to be a little bit more trusting of the vaccines, or what information are we missing? What mark are we not hitting? And so my role was to go out into the community and ask people these hour-long interview questions and just get their thoughts. And it was a no right or wrong answer, but that gave me the skills to conduct research interviews. I was part of the team that created the questions that we would ask in participants. I was able to be a co-author on a publication. So that gave me a list of skills that now, once I graduate, I can say I've, published an article. I've done field work out in the community. I've had the opportunity to, hear from the world, in a sense, where are we going wrong? What do we need to do differently? And so, again, like I would say that those were the main things that were just so, and I didn't know what I was getting myself into. I just knew like, oh, I need some kind of experience. And then as I started doing it, we would go out, Saturday and Sunday, every weekend through the hot summers, through the winter months. And we were just knocking on doors. I mean, not just random doors, but doors of people that had received these test kits. And we met all types of people from all walks of life, from all socioeconomic statuses. And so it was great because it wasn't just a certain block of people, but we really involved everybody into the work that we were doing.
I love that. That's a big deal, and that is what keeps you going. I know you've got.
Yeah.
I know that definitely does. It sounds like you're definitely impacting the cause, right? We have this huge public health crisis, and we need a lot of people who are passionate about all of the ins and outs, even things that feel granular. But this brings me to my last question, because I know that we're running out of time. Thank you for everybody who typed their questions into the Q&A. I know we were able to get to a few of them, and then there are a few that we could probably answer offline as well for those that need answers. But and you've probably given a good bit of this, but how do you feel your work in public health impacts the economy or the society at large?
I think, it really is about keeping schools healthy and safe so we can keep schools open. Schools are a big deal because there's so many kids that are involved, so many parents, so many faculty and staff members. And so really being able to, like, because you can't have kids at home. I don't have any kids, but I've seen family and friends try to manage work and manage kids at home, and it's just a disaster, and everyone's going crazy. And I mean, it just leads to so much. Kids are isolated for so long, and they're and they're not liking it. They want to get back to a social place. Parents want that break, but also it causes a burden on the economy when people are having to miss work and you can't really take care of your families, and businesses are suffering because they're shortage staff members. And then so the clients, they or the customers, they feel that, and then that also plays a role in overall quality and production. So keeping schools healthy so we can keep schools open is really it's all a domino effect. So if, like I said, if a kid is sick, that parent's home, that business owner or that organization feels it, the client or the end user feels it. But if we can keep that kid at school, I mean, of course, it's not just as simple as that, but if you
Right.
if you want to just kind of narrow it down, it's just all a really domino effect, and it's all a big circle. So with my role, I'm just, trying to keep parents sane so they're not having to be home with their kids, and we can just get back to a sense of normalcy,
Mhm.
and people are not having to, not know their status. And so with having regular testing at the schools, or having access to over-the-counter test kits, and also providing help with, units in the classrooms and in the cafeterias, in those big spaces where, a lot of congregation takes place. We're wanting to, also provide PPE. So if you need masks, if you need gowns, sanitizer, whatever you need to really keep a clean environment, that's our goal.
That's great. I'm so glad that you are doing that. It definitely impacts the society at large. And you're right. Yeah, that it's a great help for parents if the kids are back in school, you know. But it also keeps the academics going. It also keeps
Yep.
the learning flowing. It also, impacts, like you said, not just the fact of making sure that the virus doesn't take course in any other way. We're having those resources, but just making sure that the students are getting back to a more normal
Yeah,
academic.
and the kids are, I mean, and because
Yeah,
people were trying to teach kids at home, but no one can really do
and it
it
was
like
a
a teacher.
struggle.
So we also saw impact on test scores because
Yeah,
kids were home and they missed so much school. And so kids need to be able to have that, that one-on-one, that true classroom setting to be able to really, learn the material and being able to succeed. And, so we got to do some work there with getting the, kids back to where they were and getting those test scores up. And so, yeah, we need kids to be in school for all the reasons that we need them to.
right, right, exactly. Well, thank you so much, Don. I really do want to thank you for attending the Currents of Public Health webinar today. I thank you so much for participating in this informative conversation, because I think you gave some really great gems, some really great information for people that had questions, and great insight into the careers in public health and how they could be utilized, and how you've been truly able to impact a society at large.
Yeah, thank you so much, Evelyn, for having me. It's been my pleasure.
Absolutely, no problem. Well, in closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor's of Science in Public Health, a graduate certificate, a Master's of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health, DRPH. The faculty and students conduct research on the complex public health challenges facing cities across the globe. And our work is often carried out with the participation or the partnership with communities, residents, and community-based organizations committed to health equity. If you would like more information about our programs and how you'd like to support, please visit our website at publichealth.gsu.edu. Once again, thank you again, Don. Thank you for attending. And for everyone interested in our next current event, please join us. Our next webinar will be Thursday, February the 23rd at 12 p.m., featuring Dr. Carlos Paveo, who is a clinical associate professor in the undergraduate program in the School of Public Health and assistant dean for diversity, equity, and inclusion.
Yeah,
So
he was one of my professors when I was at Georgia State, and he was absolutely great. I love him to death. So you will not want to miss out on that, guys.
definitely don't want to miss out on it. And until further ado, thank you all so much. Have a good one.
All right, thank you.